And now for some more perspective on yesterday's big decision. More than 6 million Texas residents are uninsured, quarter of the state's population, highest percentage in the nation. Even so, many state representatives insist the president's health care reform is not the solution. With me now, Texas Republican Senator Kay Bailey Hutchison. Good morning to you.
Hi, Chuck.
Let me ask you this. What should the state of Texas be doing about this issue of the uninsured?
Well, certainly we need to make affordable health care more available to people in our country. That's the purpose of health care reform. But to so distort the health care system as it is in that process is not a good outcome. And I think the Obama health care plan is going to increase costs on families. My goodness, if your employer doesn't provide health care and they pay the $2,000 fine, then the individual has to pay a fine on top of that. And the fine goes up to $4,500 a year. There are people, Chuck, who are going to have to pay the fine and still can't afford to get health care coverage.
I guess,
so what are we going to do about that?
Well, I mean, I guess let me ask you this principle then. I mean, should the goal be to expand coverage? It seems to be there's a lot of economists that say you got to get more people in the system to bring some of these costs down. So how do you get more people into the system?
I think you get more people into the system by, first of all, letting private companies give health care to their employees in a responsible way. But the prescriptive nature of the Obama system says if you don't do exactly what the government mandate is, then you're still going to have to pay the fine. So if you are covering 25% of health care costs because that's what you can afford to do and still stay in business, that's not enough. You'll still have to pay the fine. So what does the business do? Of course, they drop the coverage, pay the fine because that's cheaper for them.
Well, the previous system hasn't worked, though.
Out.
I mean, let me ask you this. The previous system hasn't been working. We have a lot of people off the system. So what do? I mean, look, I go back to the state of Texas. If, there doesn't appear to be a lot of solutions coming out of the state of Texas. So at some point, is it not the federal government's problem? Well,
we do have a catastrophic pool in Texas so that people after about $10,000 expenditure do get the coverage. So that's one thing that is available in Texas. And I think that the states can come up with, and frankly, Texas could come up with more options and more plans for people. But access to affordable health care does not have to be done with this huge tax increase, a tax increase that's probably the largest in the history of our country.
Well, let me stop you there
people.
on the tax. And how is it? It's not, you don't pay the tax if you buy insurance.
Well, but there are people who are making, say, $50,000 to $75,000 a year. They're going to have to pay a fine of maybe $1,000, which they will do as a tax, but they can't afford the $8,000, $9,000, $10,000 for coverage. So you're going to have people paying a fine and still not having coverage because they're in that middle area. I think the president talks a lot about helping the middle class. I think that's exactly who he's hurting. He's helping people who can't get coverage for people who can't afford it in the Medicaid range. Yes, he is. But the middle class is paying for that, Chuck. And that's what I think people are just saying, oh my gosh, I'm going to have to pay the fine and I still can't afford coverage.
Well, we're going to have to leave it there. This is obviously going to be a fascinating debate over the next 5 months. Senator Kay Bailey Hutchison, Republican from Texas. Thanks for coming on this morning.
Thank you.
All right. Well, the man accused of killing Trayvon Martin walk out of jail again today.